I'm Daniel Metcalf, and I head up research at Convatec's Advanced Wound Care R&D group. Wound hygiene has been developed by clinicians, sponsored by Convatec, and is a relatable concept of regular, repetitive, optimal wound care that supports the healing of hard-to-heal wounds by targeting biofilm. It does this through regular, repetitive cleansing, debriding, refashioning, and use of appropriate dressings for biofilm management. We're delighted to present a technology in step 2 of wound hygiene, debridement. ChloraSolv Wound Debridement Gel is a chemo-mechanical debridement treatment presented in a simple, quick, and easy-to-use device. It doesn't require any specialist training and has 2 key features. Firstly, it softens devitalized tissue, facilitating its easy removal, where previously perhaps only a sharp debridement would suffice. And it has potent anti-biofilm activity. ChloraSolv is presented in a dual-barrel syringe. In one part is a carboxymethyl cellulose gel with an amino acid buffering system which helps keep the gel at the required pH. It also contains titanium dioxide to give it some opacity. And in the other part is a pure aqueous solution of 0.9% sodium hypochlorite. As you might imagine, these 2 parts are mixed together in the syringe upon application. Firstly, the user assembles the syringe. It's simply a case of popping off the cap, then adding the mixing nozzle and the plunger. The plunger is depressed, which mixes the 2 parts together, creating a high pH, 0.45% sodium hypochlorite gel, and a thin layer is applied to cover the wound bed. The ChloraSolv gel is left in place for between 2 and 5 minutes. This is enough time for the softening of the devitalized tissue and for the anti-biofilm activity. And this is the chemical or chemo aspect of chemo-mechanical debridement. It's important that the loosened devitalized tissue and the destroyed biofilm and the gel is then removed using a blunt instrument or a pad or wipe. And this is the mechanical aspect of chemo-mechanical. The wound is then rinsed, dried, and the process is repeated steps 2 through to 5 with a second application, then removal. This completes the treatment process, both Staphylococcus aureus and, as shown here, Pseudomonas aeruginosa. This graph shows the standard cleanser in blue and how it reduces biofilm gradually over the course of 15 minutes contact. On the other hand, ChloraSolv in purple eradicates the biofilm in just 2 minutes. Now we can visualize this effect using live dead staining under the confocal microscope, where live biofilm cells appear green and red cells appear dead. And you can see by 2 minutes in the central image, all the biofilm cells are dead, as per the graph I discussed previously. We've recently expanded upon these observations using Convatec's newly validated gauze biofilm model. In this model, biofilm is cultured on gauze, which is a perfect substrate for biofilm, and transferred to a sterile agar plate for subsequent treatment. The graph shows the results of a study where we compared ChloraSolv with a range of 15-minute antimicrobial solution soaks and with a range of physical debridement devices for 2 minutes. And this data is for MRSA biofilm. Firstly, we can see that untreated biofilm contained approximately 3 million cells, so this is a high challenge test. The 4 different antimicrobial solution soaks only gave around 1 log or around 90% reduction after 15 minutes direct contact. 2 of the physical debridement devices also gave modest biofilm reduction, although the combination of a debridement pad with a cleansing solution gave notably more biofilm reduction, as you might expect. However, only ChloraSolv was able to eradicate the MRSA biofilm in this test in just 2 times 2 minute applications. That's a greater than 6 log reduction. And very similar findings were also observed when we tested Pseudomonas aeruginosa biofilm, again ChloraSolv giving greater than 6 log reduction in this biofilm test.